Thank you so much, and thank you so much for inviting me. It's a real pleasure to be here. And there's so much I could have said, actually. So I'm sure there'll be some questions. I don't know if there'll be time for questions, but I'm just going to give you a bit of a whistle-stop tour into the world of digital health, and to try and touch on some of the points that you've mentioned. So as was said, my name is Ashall Payne. I'm the founding chief exec at ORCHA. Now, for those of you who don't know, ORCHA actually stands for the Organisation for the Review of Care and Health Apps. But our mission isn't to review or regulate the world of digital health and health apps. Our mission is to get high quality digital health tools to people who need them. And a big part of what that mission involves is getting the right tool to the right person at the right time that meets their personal preferences and needs. So it's that level of granularity. Now, before I go, I'm going to share with you how we do that. I'm going to share with you some of the key principles behind that thinking, and I'm going to share with you why it's important. But what I wanted to start with was just to introduce you into the world of digital health. When I use the word digital health app, I'm not just talking about apps on the app stores. I'm talking about web-based solutions and digital health at large. So you might be surprised to know the size of the opportunity out there in the world of digital health. So we currently have access to over 375,000 digital health solutions. Huge volumes, and this is growing all the time. So this time 7 years ago, that number was around about 30,000. So it is skyrocketing, and every day at the moment we see a new health app or a new digital health intervention coming to the market on a daily basis. What we also see is our populations are now using these tools. So every day, 5 million people will download a digital health solution. And that's increased by 25% since the start of the COVID pandemic. So people are using these tools. What we also know is when we talk to our healthcare professionals, over 80% are already using smartphones and medical apps. 40% believe that these technologies could reduce the number of visits to the doctor's office, and over 90% believe that these tools could help improve patients' health. What we also know is there is currently more smartphones on the planet than there are toilets or toothbrushes. So this is the size of the opportunity. Lots and lots of tools, lots of people using these tools. We've all bought the infrastructure, and our healthcare professionals think this is a good idea. Plus, bodies like NICE, the National Institute for Clinical Excellence, are suggesting that we should be deploying digital health to our patients and populations as healthcare professionals. And as you see in policy, particularly from our Secretary of State, Matt Hancock, there's a real push for digital. So why have we not yet embraced digital health? Well, there are 4 big problems in the world of digital health. The first big problem is awareness. People, patients, healthcare professionals and healthcare systems are not actually aware what's out there. So if I told you today that in that number, that big number, about 6,000 products can help people living with dementia, 6,000, would you have known that? The answer is probably no. As healthcare professionals, we're not aware of that. As healthcare providers or commissioners, we don't know. As people, we definitely don't know. So awareness is low, and that's a huge barrier to the adoption. The second big challenge is then access. Once we become aware that these tools are out there, where do we go to find them? And you might think, well, I'll go to the Apple App Store or Google Play. And I'd urge you to try it. Type in a word like dementia, cardiology. You'll get very few results back, and you certainly won't get the full list. The next big barrier is trust, and this is the ultimate barrier. Once you find a solution, how can you trust it? How can you trust what it's going to do with your data, how secure it's going to be from a data perspective, whether it's clinically or professionally efficacious or safe? And then the fourth big challenge is governance. So what I mean by that is if I am your healthcare professional and I find a product that I feel I can trust and I recommend it to you, what happens if it changes tomorrow? How do I assure myself and my patients on an ongoing basis that they can trust these solutions? And just by the way, that trust barrier is not unfounded. Our research at ORCHA has found that only 20% of all digital health solutions available to us meet the quality criteria that you would expect. And therefore, when you look at the size of the problem, 5 million people every day downloading a digital health app, but only 20% are safe, that's a huge problem, and that trust is not unfounded. So what do we do about this? How do we resolve some of these challenges? So the first thing we need to do is deal with the biggest issue, and the biggest issue is trust. So how do we do that? How do we make sense of it all? Well, the first thing to say, we need to take a step back and say, okay, well, what is the regulatory landscape in the world of digital health? How can we trust these tools? And if we just for a second take a lens of how we trust drugs and the world of pharmaceuticals, there's a very clear process for regulatory compliance that a product or a drug will go through before it hits the market and before we're interested in recommending or prescribing that drug to our patients. So in the world of digital health, what does this regulatory landscape look like? Well, it's a real puzzle. And the reason it's a puzzle is because there are lots and lots of regulations in different areas, in different puzzle pieces. So we have regulations in data privacy, regulations in data security, clinical and professional assurance, user experience. And each of these jigsaw puzzles has puzzles within it. So under the clinical assurance, you will have heard of certain regulations and compliances such as medical device regulations, Care Quality Commission, clinical safety standards, etc. There's lots and lots of clinical assurance regulations required. And this puzzle is ever changing. New regulations are emerging all the time. So in data privacy, for example, you will have all heard of GDPR, but there are new regulations emerging around models of consent, authentication, verification. When we start to introduce different functions and features within different products, different regulations need to emerge. So in the world of AI, what are the regulatory and compliance frameworks for that? So this is a real puzzle. And the other reason it's a puzzle is because the products are different. So in the world of digital health, just like in the world of drugs and pharmaceuticals, we have different products that have different thresholds of risk. So in the world of drugs, we can go into a supermarket and buy paracetamol. So they're on general sale. The risk of us buying and using that drug is far less than other drugs that will be prescribable or under control. And that's the same in the world of digital health. So we have to think carefully about how we apply this regulatory landscape. And what's happened over recent times is there has been a growth in digital health assessment frameworks. So in the NHSX have just launched something called the DTAC assessment framework. If you've not seen it, I'd urge you to have a look. And what that's trying to do is make sense of this regulatory puzzle. Now, as when I was introduced, ORCHA don't just work in the NHS, we work globally. And so how are we doing that given some of the nuances and differences from a regulatory and standard perspective in different jurisdictions? Well, the way in which we've done that is we've gathered all of the duplicated effort on a global scale from all of these standards, regulations and assessment frameworks. And we've pulled that into a baseline review process. I'm going to explain why it's called baseline in a second. But this is still a very robust process which goes through 350-point evaluation across all of those different domain areas. It applies the regulations in a proportionate, but more importantly, repeatable way. Every time the product updates and changes, our system triggers a re-review of the bit that's changed. And this is really important. But what I also shared with you that only 20% of products that go through our review process meet the quality criteria. And so although there are lots and lots of digital health solutions available, there aren't enough good ones. I'll explain why there aren't enough good ones in a minute. So we work with the innovator to help them to know what their gaps are for their product. Now, earlier on, you were hearing some touch points around evidence standards. And one of the things that's critical in a review of a digital health solution is, has it got the evidence to prove that it does what it says it can do? And there's a newish framework called the NICE Evidence Standard Framework. And this is a key part of what we do in this baseline review process. I've put the link in there because I haven't got time to go into all the detail about this evidence standard framework. But what this evidence standard framework is, it takes that risk-based approach to addressing what evidence is required for what product. So you have different tiers of evidence required for different risks within products presented. So for example, evidence tier level 1, you only need to have evidence that somebody has said that that product has had a positive impact for them. These products are low risk. This might be a digital recipe book, very low risk. At the other end of the spectrum, at tier 3B, these are products built on clinical algorithms that would be providing professional advice that would otherwise be received via a clinician. And the risk of these products going wrong is the complete opposite to that evidence tier 1. And these products will require clinical trials and peer-to-peer publications. And so when we're looking at what evidence is required, we have to think carefully about the risk within the product and make sure that we're looking for the relevant evidence for the product that's being presented. Now, what we then do on top of this ORCHA baseline review is we then build verticals. Depending on the country we're working in, we then ask additional questions of a product depending on jurisdictional specific requirements. So you can see on the 4th vertical along, the NHS DTAC, and you can see that a big area there is around clinical safety. So in the NHS, we have a standard called the DCB 0129, which is all about clinical safety. And we layer that on top of the ORCHA baseline review and all that other work that we have done, because that's super relevant in the NHS. Now, once the product has gone through that, we're then able to establish that this product has met the minimum standards for quality to enable us to be able to trust these tools. But that's only the first part of the journey. Once you know which products are good, you then have to tell people. And what we do is we work with different parts of the system to understand what the problem is that they're trying to solve. So we might work at national level, regional level, or organisational level. And we might work, for example, with a hospital who say, we want to use digital health to support young people and their mental health. So what we do is we then create them a digital health library or a digital health app store, which is targeting that group and is campaigned to that population demographic. Now, the really important thing here is this is not just about providing people with a list, a catalogue of tools. We have to think carefully about individuals' personal preferences and needs. So if I take that use case of a hospital wanting to use digital health to support young people who are living with mental health conditions, and we create them a digital health library and put into there, hundreds, if not thousands, of high quality mental health tools that could be relevant to that young person. Just having a long list is still not useful. That young person will want to find a solution that meets their personal preferences and needs. And if we think about this from a retail perspective, if I go on to booking.com and I was able to book a hotel, I don't just want a long list. I want to be able to filter according to my personal preferences and needs, location, cost, functions and features. And that's what these libraries do. As an end user, I can filter according to my personal preferences. And when we're talking about digital health, your personal preferences really important. What are my technological preferences? Do I have a visual impairment, a hearing impairment? My age plays a role. If I'm a child with mental health versus a teenager versus an adult, all really important. Use the filters to be able to find the right product for you and your personal needs. Now, the other thing just to note here, though, is having a repository that does that is still not enough. We know that the people who are using digital health are already activated to do so. And how do we then target our unactivated communities? Because what we don't want to have is to enhance the digital divide that we're starting to see. So what we do is we work with healthcare professionals. These are the trusted people in our communities who have touch points with these people. And if a healthcare professional recommends anything to us as a patient, we are significantly more likely to use it. In order to do that job, we must train our healthcare professionals, enable them to activate people and patients. But I talked earlier on about a number of other barriers, including governance. If I am a healthcare professional and I'm going to recommend you a digital health tool, I need to know it's good today and that it continues to be high quality. So what we do is we enable healthcare professionals to use this library as a formulary. In the same way that we have formulas for drugs, this is now your digital health formulary. And you can use this to recommend or prescribe a product to a patient via text message. The system will continuously re-review these tools, and should a future fault be found, we can do a recall, and therefore governance is established. So working with clinicians and clinical teams is critical, and that starts with the education and the training, because in the same way that we have to raise awareness in our communities, we have to do the same for our healthcare professionals, and this is just an example of what that looks like. Now, the question that you may have is, why not just have one digital health library? And I'm going to explain why. The reason why is because this is an early space and we have to be extremely targeted in what that library is going to be used for. So this is an example from Cheshire and Merseyside. The Cheshire and Merseyside accreditation repository is all the tools that have met the relevant regulatory requirements. We then have different distribution channels and different distribution channels in different libraries depending on the lens. We have one for maternity, one for students, one for social prescribers, one for primary care, and the campaign and the change management that's required around those libraries is critical. Now, to bring this just one layer lower, why is one app not enough? Very, very quickly, why is one? I get asked the question, what is the best diabetes app? And the answer is, it depends. It depends on the person and their personal preferences and needs. So here's an example. If we're going to talk about building fitness after COVID, it depends on what that person needs, depends on the product that they use. Equally, in managing mood and coping with frustration, it depends on what the person needs. So we have to really think this through. I'm just mindful of time, so I'm going to whiz through these and finish here. So if we are really going to embrace digital health, we must build trust. We must think about how we're going to activate the whole ecosystem, but we must build strong governance and risk management. Thank you so much, and apologies for going over.